Hi, my name is Taiwo Busari. I'm a nursing student at the University of Manitoba. I'm here to make a video about safe medication administration technique and hygiene. Scenario is the date is March 10, 2020. The time is 7:50 a.m. Nursing Jake, fee number 312-654-987-987. According to the mark sheet, I have two transcriber signature here, so I can go ahead with the order. Docosahexaene sodium, suspension, 60 mg, PO, BID. The first one is due for 8 a.m. I can legally give it and I've confirmed the one I was given today, March 10, 2020. Latanoprost and eye drops 0.005%, 0.005%, 2 drops to the right eye, daily at HS is due for 2200. I'm not going to be preparing this medication because it's not due yet. Levofloxacin 500 mg PO daily is due for 8 a.m. I'm going to be giving this medication and I'm giving today, March 10, 2020. Ramipril 10 mg PO daily is due for 8 o'clock a.m. I'm going to be giving this medication I've confirmed one as given today, March 10, 2020. So now I'm just going to be putting my doctor's order at the side and I'm going to be bringing out my medication. I'm going to start with the Docosahexaene sodium. Docosahexaene sodium is the same medication. I've confirmed that using my med card. It says suspension. The doctor needs 60 mg. The medication comes in 10 mg per ml. So I have to take 6 ml to get 60 mg. It says PO, which means already this is another medication. I can take a reasonable amount from here, so I'm just going to put that aside. Latanoprost, I'm not preparing this medication right now because it's not due yet. The next one is the levofloxacin. Levofloxacin, the doctor needs 500 mg. The medication comes in 250 mg per tablet, so I need 2 tablets. It says, as I can take a reasonable amount from here, it says PO, which means oral is another medication. Ramipril is the same thing as all this. I've used my drug card to confirm that. 10 mg, that's what the doctor needs. The medication comes in 10 mg per tablet, so I just need 1 tablet to make it 10 mg. I can take a reasonable amount from here. It says PO, which means oral is another medication. So now I'm just going to be checking my medication for the expiry date, and it's not expired yet. I'm going to be checking my medication for the expiry date. It's not expired yet. I'm checking my medication for the expiry date. It's not expired yet. I'm going to be doing my hand hygiene for preparing the medication. I'm going to start with the Docosahexaene sodium. The doctor needs, so Docless is sometimes Docosahexaene sodium. The doctor needs 60 mg. The medication comes in 10 mg per ml, so I need 6 ml to make it 60 mg because it's an oral suspension. I have to shake it. Okay. I'm going to be doing hand hygiene because I have some medication in my hand. I'm going to be doing hand hygiene because I have some medication in my hand. I have 6 ml here. I have 6 ml here. Yeah. I'm just going to be covering it. This is my med waste. I'm going to be making my label. NJ, that's the name of the patient. Docosate sodium. The dosage is 60 mg. The volume is 6 ml. The concentration is 10 mg per ml. Confirming that at the container. The signature is TB UMS. My date is March 10, 2020. Time right now is 7:30 a.m. Signature is TB UM. UMSN2. Okay, so I'm going to put it on the side. Latanoprost, I'm not going to be preparing this because it's not due yet. The next one is levofloxacin. The doctor needs 500 mg. The medication comes in 250 mg per tablet, so I need 2 tablets. Patient name is NJ. The medication name is levofloxacin. The dosage is 500 mg. The volume is 2 tablets. The concentration is 250 mg per tablet. The date is March 10, 2020. So my time right now is 7:31 a.m. Signature is TBUMSN2. The last one is Ramipru. Using the drug card, I know that all tests isn't as Ramipru. The doctor needs 10 mg. The medication comes in 10 mg per tablet, so I need 1 tablet. NG is the patient name. Ramipru is the name of the medication. The dosage is 10 mg. The volume is 1 tablet. The concentration is 10 mg per tablet. The date is March 10, 2020. My time right now is 7:35 a.m. My signature is TBUMSN2. So now I'm just going to go ahead to do my second check. I'm going to be starting with the Docosate sodium. Not Synjek. Docosate sodium. Docless is the same thing as Docosate sodium. Says suspension. This is another suspension. I have another suspension here. The doctor needs 60 mg. The medication comes in 10 mg per ml, 10 mg per ml. So I'm supposed to have 6 mLs, and I have 6 mLs here. I have 6 mLs here. It says pill, which means orally this is an oral medication. BID, the first one is due for 8 a.m. It's currently 7:40 a.m. I can legally give them. I've confirmed one I'm giving it today, March 10, 2020. I'm going to be returning this back to the cat. Put it aside. The next one is the latanoprost. I didn't prepare this medication because it's not due yet. The next one is levofloxacin. Nursing Jake, levofloxacin. This is levofloxacin. The doctor wants 500 mg. The medication comes in 250 mg per tablet. 250 mg per tablet. I'm supposed to have 2 tablets to make it 500 mg, and I have 2 tablets here. It says PO because PO, which means orally, this is another medication. Daily is due for 8 a.m. It's currently 7:45 a.m. I can legally give it, and I've confirmed one has given it today, March 10, 2020. I'm going to return this back to the cat. I'm going to put this on my tray. Nursing Jake, Ramipru. All tests is the same thing as Ramipru. The doctor needs 10 mg. The medication comes in 10 mg per tablet. So it comes in 10 mg per tablet, and this is 10 mg per tablet. I'm supposed to have 1 tablet to make it 10 mg, and I have 1 tablet here. It says PO, which means orally, this is another medication. Daily is due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed one as given it today, March 10, 2020. I'm going to return this back to the cat. I'm going to put this in my tray. I'm going to be taking my pen to sign my mark sheet, and I'm also going to be taking my glass of water. I'm going to be taking my mark sheet also all to the patient's room. Hand hygiene, safety check done. Patient is at the lowest position. Call bell has reached. There's no tripod on the floor. Patient is not at distress. So now I'm coming in, doing my hand hygiene. Okay. Hi, my name is Tayo Busari. I'm your student nurse for today. I'm here to give you your medication. Before I proceed, I would just like to check your handband just to confirm that I am in the right room. If you don't mind, I'm going to checking your armband. Nursing Jake. Phone number 312-654-987-987. Please, can you tell me your name, please? Nursing Jake. Okay, thank you very much. Can you tell me your date of birth, please? Okay, January 1, 1960. Thank you very much. Do you have any allergy that you know of? No. Okay, according to the mark sheet, you have no known allergy, so I can assure you that everything is fine. I'm just going to be doing my final check before coming to give you your medication. Thank you. So I'm going to be starting with my Ducosate sodium. Nursing Jake is the same thing as NJ. Ducosate sodium, and I have Ducosate sodium here. It says suspension. This is a suspension. The doctor wants 60 mg. The medication comes in 10 mg per ml. So I'm supposed to have 6 ml by my calculation to have 60 mg, and I have 6 ml here. Yeah, I have 6 ml here. PO, which means orally, this is another medication. BID, the first one is due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed one has given it today, March 10, 2020. The next one is Nursing Jake, latanoprost. I didn't make this medication because it's not due yet. The next one is levofloxacin, nursing jake, levofloxacin. The doctor wants 500 mg, 500 mg. The medication comes in 250 mg per tablet. I'm supposed to have 2 tablets to make it 500 mg, and I have 2 tablets here. It says pill, which means orally this is another medication. Daily. It's due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed one has given it here today, March 10, 2020. Next one is Ramipril. Nursing jake, Ramipril. The doctor wants 10 mg. The medication comes in 10. So the doctor wants 10 mg. The medication comes in 10 mg per tablet. So I'm supposed to have 1 tablet to make it 10 mg, and I have 1 tablet here. It says pill, which means orally this is another medication. Daily is due for 8 o'clock. It's currently 7:45. I can legally give it, and I've confirmed one has given it today, March 10, 2020. So now I'm going to be raising my patient's bed to my waist level, and I'm also going to be putting my patient, I'm going to also be raising the head of the bed to the Fowler level, Fowler position. Okay, just did that. So nursing jake, I'm going to be educating you about the medication that I'm going to be administering to you. I'm going to be starting with the Ducosate sodium. Nursing jake, the Ducosate sodium is a lactative. It's a lactative for your constipation. I assumed I would have checked your blood pressure and also bowel movements before giving you this medication. The side effects you can have is nausea. You can also have loose stool. If you feel any of this, please let me know. One thing I'm going to advise you is that you should increase your exercise and also increase your mobility when taking this medication. Before I go ahead to give you this medication, I would like to ask you if you had bowel movement today. Okay, you haven't had bowel movement. Okay, I can legally give you the medication. Should I go ahead to give you the medication? Okay, I should. Okay, thank you. Do you prefer the medication through the oral syringe, or you prefer it through the cup? You prefer it through the oral syringe? Okay, I'm just gonna give you through the oral syringe. And then this is water for you to drink with it. Have you swallowed it? Okay. So the next one I'm going to be giving you, nursing jake, is your levofloxacin. Your levofloxacin is an antibiotic medication for your urinary tract infection. I assumed I would have checked your temperature. I will also check your CBC, which is your complete blood count, particularly your white blood cell, before giving you this medication. I also assume I'll be monitoring your renal function because it's an antibiotics. The side effects that you could have is headache, dizziness. I will advise you not to change your position rapidly due to this dizziness. It's okay if you haven't eaten anything today. It's fine if you take it on an empty stomach. Another thing I'm going to advise you is that you should take a lot of water because it's an antibiotics. So I am checking on the vital signs so I can be able to monitor how far the medication is working. Should I go ahead to give you this medication? So for the side effects, if you feel any of the headache or dizziness, please let me know. Should I go ahead to give you the medication? Okay. And this is your water to swallow it. Have you swallowed it? Thank you. Okay. The final one I'm going to be giving you, nursing jake, is your Ramipril. Your Ramipril is an antihypertensive medication for your high blood pressure, because we noticed that your blood pressure has been increasing of recent, so we decided to give you put you on an antihypertensive medication. I assume I would have checked your blood pressure and your apical pulse before giving you this medication, so I can be using to monitor how far you've gone with the blood, how far your blood pressure is improving. The side effects you can have with this medication is headache or dizziness. I will advise you, due to the side effect, that you should not change your position rapidly because of the dizziness. should I go ahead to, so for the side effects, if you feel of this, please let me know. Should I go ahead to give you the medication? Okay, then this is water for you to swallow it. Have you swallowed it? Okay, thank you. So now I'm just going to be signing my mark sheet, Nursing Jake. TBUM SN2 0750 TBUM SN2. So now I'm just going to be putting, nothing, I'm just going to be putting you at the lowest position. But I'm sorry, I still have to leave you on the Fowler position because you have to be on this position for at least 30 minutes so the medication can go down. I hope you are comfortable. I'm going to be coming after every 30 minutes to come and be assessing you. But like I said earlier on, if you feel any of the side effects I said earlier on, please make use of your cowbell. Okay, so cowbell at reach. There's no tripod on the floor. My patient is at the lowest position. No patient is not at distress, not tripping outside on the floor. Thank you very much, Nursing Jake, for your time. So then I'll see you in the next 30 minutes. So now I'm done with my medication administration. I'm going to come in every 30 minutes to come and assess my patients. Thank you. Bye.